So it's nice to see familiar faces. So I prepared notes in order to be on time, and maybe we will finish earlier. And so I'm really excited to be here and have the opportunity to share our research about the characteristics of minimally verbal children with ASD before and after the age of 5. And this is a very special group, which is often unrepresented in the research. And I would like to make a disclosure that this research was funded by the Azrieli grant, and I really would like to thank for this grant. And the core study is a collaborative effort with my doctoral student, Leah Kaufman, who is currently on a maternity leave, so she's not here with us now, and Professor Gabis, who initially initiated this project. And I am Salvadi Harussi, and I'm a speech-language pathologist and the head of the Augmentative and Alternative Communication Lab at Ariel University. And our aim is to better understand this group by understanding the characteristic, intrinsic and extrinsic characteristic in order to develop intervention using the AAC to have a better outcome of the communication. Okay. So let's begin with some of the background. So actually we heard at the morning by Professor Carter about the prevalence. As we know, a higher diagnosis rate of autism tend to be found in population with higher income levels, and these rates vary significantly across different regions and countries. And this suggests potential disparity in access to diagnosis and services. And as you can see, we already talked in the morning that in the US, it's 1 for 36 children are diagnosed with ASD according to the CDS. And what's happened in Israel, we also heard in the morning, but I will repeat it as well. So you can see here, the graph shown here presents differences in ASD diagnosis rates across various SCS levels in Israel population between 2000 and 2018. The color represents SCS status based on average income in the area. You see that number 1, shown in yellow, represents the lowest status, and 10, shown in green, represent the highest. I'm sure everybody knows which cities are number 1 in Israel, and some cities tend to be number 10. And if you look at the prevalence of autism in this area, you can see that the number displayed on the bars represent diagnosis per 1,000 people. We can observe that throughout the 20 years examined, there was a consistent gap of approximately 50% lower diagnosis rate in lower SCS areas compared to higher SCS areas. And the research suggests several explanations for this disparity, and such as limited resources for child development and restricted access to healthcare services, even those here in Israel. And later on, when we will talk about the clinical implication, we will focus on the SCS and how can we help in this area. So let's move on. So regarding the prevalence, it's also important to know that the changes in diagnosis rate over recent years, as shown in this graph, there is a clear upward trend in the number of diagnoses per 1,000 people over recent years. This increase in prevalence is attributed to growing autism awareness and changes in diagnosis criteria, as we heard already in the morning. And there are also hypotheses about the environmental factor. Through this, haven't yet sufficient research yet, and we will zoom in about the SCS factor and environmental factor that can contribute also to the definition of the minimally verbal children. Okay. I would like to talk here about the diagnosis here in Israel, and I'm sure most of you are aware of that. So in Israel, when this research was conducted, the process must be carried out by 2 professionals, one being a psychiatrist, neurologic or developmental pediatrician, and the other a developmental or clinical psychologist. Additionally, the diagnosis process includes assessment by other professionals to evaluate developmental abilities, cognition, functioning, and ASD symptoms. Typically, the first professional to see the child is speech-language pathologist. How many speech-language pathologists are here? And also, we heard in the morning that usually the first concern of parents that come to speech with a child with autism is that he's nonverbal or have language difficulties. So we are the first one who can see it in the child developmental centers, which I work in my career. So, so we know this is the diagnosis. And now I would like also, this is very important to understand how the cognitive assessment impact our diagnosis of the child. So according to the DSM-5, the fifth criterion is required to make a distinction between intellectual disabilities and autism. This is the co-occurring. So how can we distinguish which is the primary cause? So cognitive assessment is an integral part of the ASD diagnosis process. However, this presents challenges due to its demand on social skills such as limitation and language abilities. And all of us know the challenges how can we assess a child nonverbal with all the cognitive assessment and how it may impact our diagnosis of the child. And also it's very important to know that before the age of 5, cognitive abilities are still developing. So the focus is on developmental milestone acquisition using various developmental assessment tools. And we know that only after the age of 5, the IQ assessment is required due to cognitive stabilities. So after the age of 5, we can determine the IQ of the child. So, but what happened to these children who are minimal verbal? How can we know really what are the cognitive abilities and what are true skills? So although language abilities are not considered a core diagnostic in order to have ASD, we know that it's a spectrum. We all know that it's a varied spectrum. So we know that there is a higher prevalence of delay in language developmental milestone among this population. And we know that the spectrum of speech development in children with ASD is broad, ranging for children with no functional speech, those who has no language impairment at all. So it's really a wide spectrum. And this presentation and our motivation is to look of those minimally verbal children, what we know about them and how we can better help this population. So moving on, a high percentage of children diagnosed with ASD also present with language difficulties. We all know that. Sometimes appearing early in development and other times emerging later when different pragmatic language demand arise. Also in the morning, she said that most of the children that are assessed in 2 years old are those of children that have a severe language impairment, so the first cause that they come to assessment. So researchers have found that over 85% of children with ASD show delayed acquisition on initial vocabulary compared to typically developing children. Sorry to say typically developing children, but I use this term here. So along with delay in expressive language development, language difficulties also include pragmatic challenges and difficulty with nonverbal communication such as gesture, facial expression, and approximately 1/3 of those diagnosed are classified as minimally verbal. So if we saw that there is a the number of children who are diagnosed with ASD grows, so 30% of them supposed to remain minimal verbal according to the recent literature, and that's what we want to say was the prevalence in the cohort of Ben-Gurion data. So in this study, we focused on minimally verbal children, a group that despite a high prevalence among children with ASD has been under studies in the literature. So there are widely varying definitions in research regarding what constitutes minimally verbal. Some studies refer to the complete absence of speech, non-verbal at all, while others consisted varying vocabulary from 5 to 10 words up to 20 words, or even more. So there is really inconsistent, and if you read many research, every study has different definition of this minimally verbal population. So this may explain the difference in prevalence across studies when you hear the prevalence. And most studies agree that approximately 1/3 of the ASD child population is minimally verbal. That's if you want to write a paper, so 30% will be like, okay, it could be a good number, but it's vary. So it's important to know that language ability in this population are dynamic, and early intervention can aid in developing functional language and communication skill among minimally verbal children. And we will, at the end, if I have time, I will tell you about our research about the intervention. So now we are going to focus on our research question. So the current study aimed to characterize the minimally verbal population by examining personal intrinsic and extrinsic factors. So, and also environmental factors and also child characteristics. So we focus on socioeconomic factors, cognitive factors. Age, and an additional question was we wanted to know the prevalence of the children before and after the age of 5 in this population. So what do you think? It's, what will be the prevalence before the age of 5 of those who were assessed as with ASD versus after the age of 5? So what's happening in the prevalence and why? So this was a retrospective study. So can you see the process of the study, of the chart review study that included analysis of data from children diagnosed at the National Autism Research Center here in Ben Gurion between 2014 and 2023. And our inclusion criteria were very simple. So we the children who participate in the study was about, we wanted to have the diagnosis date and ADOS assessment, and also the module. If the child had module 1, so it considered minimal verbal. It's very broad. We didn't have other data of specific language assessment, and based on that, okay. So let's look about the sample. So we took the identified data was received. We have 581 data, and after filtering out children who didn't meet the study criteria, so we had at least 474 children remained, with 84 children have also assessment before and after the age of 5. So because every participant is valued, so we consider them in both groups. So in total, we have like 558 observation of assessment, and we split this this group for 4 groups. The average age was 3 years old and 3 years old. And the gender distribution really follow what we know in the literature, so 1 to 4. We have 441 boys versus 116 girls. So it's also match the literature. So we took all these numbers of all this data. So to compare the different characteristics, we classified into groups based on age, diagnosis, and speech abilities. So in total, we have 4 groups, 2 groups of speaking and minimally verbal, children under the age of 5, and 2 groups of verbally speaking and minimal verbal children above the age of 5. Is that clear? Okay. So let's look about the prevalence. So here you present the prevalence results found in our sample. So blue represent verbal children and light blue represent minimally verbal children. So we can observe the significant change in verbal abilities occurring over time. So despite a significantly higher percentage of minimally verbal children under the age of 5, so you see under the age of 5, 65% of the children were considered minimally verbal, and after the age of 5, the percentage of prevalence went down to 17% children. What we look on, in addition to the prevalence, we wanted to examine the SCS differences between verbal and minimal verbal children groups. So we perform a logistic regression analysis. And what you can see here consider the SES. So you can see that the minimally verbal children had lowest SES compared to the verbal children. You remember the number of the SES, 1 to 10? So you can see the SES. You can see also difference in the crawling onset. If we know the relationship between motor ability and speech, so we can see that the differences in motor developmental milestone acquisition for crawling. So the so when examining developmental milestone acquisition, a significant effect was found for crawling onset age, with verbal children showing a later crawling age. We also assess the cognitive characteristics, and we can see also here differences. Cognitive score showed significant alignment with the verbal group. The mean cognitive score among the verbal group was 86 compared to 58. So, and this has a red flag because we will talk about the cognitive assessment, but you see the differences in the cognitive characteristics. Also, you can see, if we talk about the autism severity, according to the DSM, so the graph shows autism severity data, where higher severity indicates lower functioning. So here, too, there is a significant difference between the groups. So here is the summary of what we found in this comparison. So the research finding revealed differences between verbal and minimal verbal group in cognitive, developmental, and environmental characteristics. On average, minimal verbal children come from lower SES, show later crawling development, and demonstrate lower cognitive abilities, and present higher autism severity. So when examining the prevalence of minimally verbal children, we can observe significant encouraging changes in minimal verbal rates above and below the age. So taking all this together, as a clinician and a speech-language pathologist, what we can learn from this result. So this research has several important clinical implications. This includes the need for developmentally appropriate assessment tool for nonverbal children. So in our lab, we developed this kind of tools to better diagnose the verbal ability. Additionally, this is the last slide. Yes. And additionally, the variation in minimally verbal definition in research, we have to define better who is the group of minimally verbal and how we define these children in the literature. And furthermore, to reduce the risks of remaining minimally verbal, there's findings highlight the need for policy changes. We talk about policy changes, and ensure equal access to early intervention services across SES groups, and also to early intervention of augmentative alternative communication. And also, I would like to finish with this quote, that not every child has an equal talent or an equal ability or equal motivation, but they should have the equal rights to develop their talent, their ability, and their motivation. And I'm glad to say that we received a grant from the Ministry of Health to implement our Hebrew co-vocabulary project with minimally verbal students at school-age students, to implement this intervention in order to promote their language, even with older minimally students with ASD who are minimally verbal. So thank you so much and for your attention.